here at ASH 2020, we're going to present our abstract of outcomes in frontline therapy for adult T-cell leukemia lymphoma, a pool analysis of 2 institutions. In our retrospective analysis of patients with this uncommon aggressive T-cell lymphoma that is a little bit more prevalent down here in Florida due to our Caribbean and South American population, and certainly being a disease of minorities, we have some experience in this particular lymphoma. We analyzed patients both diagnosed and treated in both institutions, the Moffitt Cancer Center and Memorial Healthcare System, and we compare the outcomes of frontline therapy on 61 confirmed patients with ATLL. We noticed that the most common presentation was the leukemic or acute subtype, followed by the lymphoma subtype. And we noticed that there was no major difference in outcomes, that being progression-free survival and overall survival, with any type of therapy that we use for those patients, regardless of the intensity of the therapies. Of note, we did notice that patients who achieved either a complete response or a partial response had better outcomes, both progression-free survival and overall survival. As a conclusion, in our retrospective cohort, we noticed that patients with ATLL, more specifically the acute or leukemic subtype and lymphoma subtype, they still have poor outcomes with current available frontline therapies, especially patients who have primary refractory disease, and collaborative and multi-institutional studies across the US and other parts of the world where this disease is prevalent are desperately needed for this population that especially affects minority populations in our country.